Are you feeling like your desire just isn't what it used to be? You're not alone. Low libido in women is a topic often surrounded by misconceptions and silence. Many women experience fluctuations in sexual desire at some point in their lives, but rarely is the issue openly discussed. Let's be real. Libido is a complex thing. It's not just about mood or what's happening in your love life. Is low libido in women normal? Can birth control cause low sex drive? What can I do to improve my libido? When should I see a doctor about low libido? We will answer all of these questions in this video. There are a lot of factors that can cause a woman's sex drive to take a dip. So let's explore the top reasons. 1. Hormonal changes. Women's bodies go through a lot of changes, and hormones are often the biggest culprits behind a low sex drive. For example, during pregnancy, breastfeeding, or menopause, estrogen and testosterone levels can drop, making sex seem less appealing. Even monthly menstrual cycles can affect your libido. During menopause, estrogen levels drop significantly, often leading to vaginal dryness, discomfort during intercourse, and a reduction in sexual desire. Similarly, testosterone, which many associate primarily with men, is also present in women and plays a role in sexual drive. A decline in testosterone, which can happen with age or due to certain medical conditions, may result in a diminished interest in sex. 2. Stress and mental health. Stress is a huge libido killer. Whether it's work, family, or personal struggles, when stress takes over, it's hard to feel in the mood. Anxiety, depression, and mental health issues can also play a big role in reducing sexual desire. Practicing mindfulness and stress reduction techniques, such as meditation, can help you feel more relaxed and in tune with your body. This can lead to an increase in sexual desire. Before we jump to the next point, to keep this channel going, please hit the subscribe button. It truly makes a difference. Thank you. 3. Relationship issues. Your relationship matters too. If there's unresolved conflict, lack of communication, or emotional distance with your partner, that can directly impact your sex drive. A healthy emotional connection is often the foundation for a healthy sexual connection. Creating intimacy through non-sexual activities can also reignite the spark. Spending quality time with your partner, such as going on dates or trying new experiences together, helps build emotional closeness. 4. Medications. Surprisingly, medications can be a major factor in low libido. Antidepressants, blood pressure medications, birth control pills. These can all have side effects that reduce your sex drive. If you think your medication might be the issue, always talk to your doctor. 5. Body image and self-esteem. How you feel about your body plays a huge role in your libido. If you're not feeling confident or comfortable in your own skin, it's tough to get in the mood. Self-esteem issues and body image concerns can make intimacy feel less desirable. Make time for activities that nourish your mind and body. Whether it's a hobby, a relaxing bath, or simply spending time in nature, self-care helps you feel more centered and connected to yourself. Be mindful of the time you spend on social media. Following accounts that promote unrealistic beauty standards can negatively impact your body image. Instead, curate your feed to include body-positive messages and inspiring content. 6. Fatigue. In today's fast-paced world, many women juggle multiple responsibilities, such as demanding careers, household chores, and family obligations. This constant busyness can lead to physical and mental exhaustion, making it challenging to find the energy or motivation for intimacy. When a woman is fatigued, her body produces higher levels of cortisol, the stress hormone, which can inhibit sexual desire. Additionally, exhaustion can diminish overall energy levels, leaving little room for sexual thoughts or activities. Emotional fatigue may also play a role. When a woman feels overwhelmed, her mental focus shifts away from intimacy, prioritizing rest and recovery instead. Moreover, fatigue can affect mood and self-perception. A tired individual may feel less attractive or desirable, further contributing to decreased libido. 7. Physical health issues. Finally, your physical health matters too. Conditions like diabetes, thyroid problems, and chronic pain can all lower your libido. Chronic health conditions can significantly impact a woman's libido due to various physiological and psychological factors. For instance, women with diabetes may experience reduced sexual desire because high blood sugar levels can lead to nerve damage and poor blood flow, impairing sexual function. Thyroid disorders, such as hypothyroidism, can disrupt hormonal balance, resulting in fatigue, weight gain, and depression, all of which contribute to low libido. Conditions like polycystic ovary syndrome also affect hormone levels, and can lead to irregular menstrual cycles and mood swings, further diminishing sexual desire. Cardiovascular diseases hinder blood flow, which is essential for sexual arousal, leading to reduced interest in intimacy. Chronic pain conditions like fibromyalgia or arthritis create discomfort during sexual activity, shifting the focus away from pleasure. Alright, now let's tackle some common myths about women's libido, because there's a lot of misinformation out there. And trust me, some of these might surprise you. Myth number 1. All women should have a high libido all the time. This one is so common and really misleading. Libido naturally fluctuates throughout life, and no one, man or woman, is supposed to have a constantly high sex drive. It's completely normal for it to change based on things like hormones, life stressors, or even just how you're feeling that day. So if you're not always feeling in the mood, don't worry, you're not alone, and definitely not abnormal. Myth number 2, libido issues are only psychological. Here's another big one. People think libido issues are all in the head, but that's far from the truth. While mental health is a major factor, physical conditions like thyroid problems, chronic pain, and even certain medications can impact your desire. So it's important to look at both your mental and physical health when addressing low libido. Myth number 3, low libido means you're not attracted to your partner anymore. This one can create unnecessary worry in relationships. Just because your libido is low doesn't mean you're not attracted to your partner. Other factors, stress, fatigue, hormones, could be at play and have nothing to do with your feelings for your partner. Myth number 4, low libido can only be fixed with medication. While medication is sometimes a helpful solution, it's not the only option. Often, lifestyle changes like reducing stress, exercising, or getting better sleep can improve libido. Therapy, whether it's couples therapy or individual counseling, can also be a huge help. Myths like these can really create pressure, but understanding the truth about libido is empowering and can lead to finding real solutions. Before we wrap things up, I know you probably have some questions, so let's answer a few FAQs about low libido in women. Is low libido in women normal? Yes, low libido is completely normal at different stages of life. Changes in hormones, stress levels, relationship dynamics, or even physical health can all affect it. If it becomes a constant issue, though, it might be worth speaking to a healthcare professional. Can birth control cause low sex drive? Yes, birth control pills can sometimes lower testosterone levels, which may lead to a decreased sex drive. If this happens, consult your doctor. They might recommend switching to a different form of contraception. What can I do to improve my libido? Great question. It depends on the underlying cause. Managing stress, exercising, getting enough sleep, and maintaining open communication with your partner can help. Can mental health affect sex drive? Absolutely. Mental health conditions like anxiety and depression, as well as stress, can have a significant impact on libido. When should I see a doctor about low libido? If low libido is affecting your relationship or personal well-being, it's time to see a healthcare provider. They can help determine if there's an underlying issue and guide you toward the right treatment. Please check out our next video above. See you shortly in the next video. Low libido can be challenging, but it's important to remember that you're not alone, and there are solutions.